record it to Zoom. Okay, so we are live on Facebook right now, and I'm just going to reposition this so I can see you straight on. Hello, welcome. This, girls, for everybody who doesn't know, this is Claire Deeks. She's a lawyer, and she's pretty amazing, and I'm going to let Claire introduce herself to you and tell you girls a little bit more about what she does and what she's all about and why we're having this chat tonight. So thanks for coming.
Thanks, Natalia. Yes, my name's Claire Deeks, and I am originally from Taranaki. I grew up on a farm there, so now I live in Auckland down in the Viaduct with my son Dom. He's 9 years old, and I am background as a corporate lawyer. So I was doing that for about 15 years, and then I've actually more recently had set up some businesses of my own, including some network marketing with doTERRA essential oils, and then like an oil accessory shop as well that I run with a girlfriend, and another business with a couple of girlfriends. So 3 different businesses that I've been running, and then more recently have found myself involved in politics. So but I do usually blog quite a bit, which is, I think, because Natalia, when you got in touch with me, you didn't know I was doing anything with politics, I think. So I just was blogging since January about how I see that we really need to think more critically about different things that are happening. And so I put quite a lot of posts up about my views on different things that are happening around the world. And quite a few people shared those. So I was doing that. And for a while as well before this, I have run a food blog that some of you might know called Dom's Kitchen, after my son. And I did start that whilst I was working as a lawyer, and I grew that to about 40,000 followers across different social media. And it was back in the day when it was just kind of getting started with everybody doing the mummy blog type of things. Back when people said that I might be killing my kid because we were feeding him paleo food and not all this other stuff. So yeah, that's a little bit of what I've been doing leading up to now.
Yeah, so that's kind of a while ago, isn't it? Because I mean, now people know that paleo food doesn't necessarily kill your child. So okay, that's amazing, and you've got yourself quite a big following. And do you know, because I'm only a real recent foodie myself, like I'm just starting to get on that bandwagon a little bit myself. So I actually hadn't heard of you, so I can sort of come across. Yeah, I'll be a little bit naive about all these things because I didn't know lots of things that you're into. I just heard you speak. I knew that you were passionate. I thought you would be an amazing speaker to get in just to talk about what you were talking about the day that I heard you. And then as it unpacked, I found out you're all of these other freaking cool things as well, which is amazing. I'm just trying to change my gallery view so that I can see, okay, we'll just keep it like that. That's not quite so big how I saw it before. Is that all right for you?
Yeah, maybe I can change to, I'll speak of you like that, yeah. But you will be recording it, I don't know, does it record just the 2 of us?
Yeah, sure. Well, yeah, I can see the 2 beneath as well, but let's just see what happens. That's all right. Okay, so in the 30 plus group, we just decided that we would start a few, we can see Linda, just don't do anything crazy, Linda. We decided we'd have these nightly political discussions, and really it was just because I thought to myself, I didn't know heaps about politics. I had to dig in deep and dive real deep to find some answers to some questions for myself. So I thought, okay, well, you know, we're just a month or so away from the elections, and I really thought, well, if I didn't know all of this, then there must be other people who don't know all of this. So I thought, let's just have some conversations and let's just ask people who do know what they're talking about to answer some questions for us. So I have emailed a few people, some have got back, some have not, and so I'm just bringing on the people who are happy and willing to come and have the conversation with us. And so tonight you were going to tell us, and I thought, so if I didn't really understand this very well, there'd probably be heaps of other people who didn't as well. So you were going to tell us, what is the Bill of Rights? What is it, and what does it mean to us as New Zealanders?
Yeah, so that's what I thought is kind of interesting, because a lot of people don't get how these work together, and they think, oh, we've got a Bill of Rights, so therefore all of the legislation we have must be run by that and be good to go, right? So it's just to understand that the Bill of Rights, so that's our rights that are enshrining these fundamental human freedoms that, generally all around the world, people have come to the agreement that there's certain freedoms and rights that we should have. Where I just put this little list of them. For example, the right to refuse to undergo medical treatment, the rights to freedom of peaceful assembly, the rights to association and the rights to movement, the rights to be free from unreasonable search and seizure, right? So these are some classic rights that are enshrined in our Bill of Rights. But one thing that a lot of people don't realize with our Bill of Rights, which is unlike, say, the United States Constitution, is that we have a section 5 in that Bill of Rights, which means that that if there's a justified or proportional way that they can be overruled, right? You can just, so you take, for example, this is why it's relevant, is because I was looking at the COVID-19 legislation, is that you take that act and when it was being considered as a bill, the ministry compares it and looks to see if it's consistent or otherwise with the Bill of Rights. Actually, what a lot of people might not have realized is that as they went through and compared it to all of our freedoms, they found that it was inconsistent, right? Because as you can imagine, being locked down in your home or not allowed to freely meet with more than one person or 10 or however many it's been, does restrict those freedoms. But at the time, and this is back in May, they held that that was a reasonable limitation because of the grave threat posed by COVID. And then so at each point they were like, yes, inconsistent, however justified, and therefore allowed under Section 5 of the Bill of Rights. So that's how we get to a situation where we do have a Bill of Rights, but there's a big argument that whether that has been upheld. And I would say not, because I would argue that it wasn't proportional and that the risk and threat was not such that we should have had to override those fundamental human rights.
Yeah. So in the very first lockdown, I've had this conversation with Dr. Simon Thornley as well. In the first lockdown, even he said, yes, I think it was reasonable to think that we should, have tried that out. We thought that COVID was a big threat, and we thought, I'm sorry, I don't know what's going to happen with all the people coming on. I'm not sure how they're going to view you on the screen, but just so you know, we can see you, just so you know. He said that, it was reasonable to think that we should do something, to do the best for New Zealand and look after ourselves and look after everybody else. And so when you say that the Bill of Rights was overridden but justified at that first lockdown, do you think, not in hindsight, but do you think at the time that was actually justified to do that?
Well, not really, because by the time they actually got around to enacting this legislation, that was already May. So they were really fixing past mistakes, which there was then a case that went to court, and they found that at least the first week, I think, I haven't looked too further down, there was held to be that it was unlawful, that they hadn't acted with proper lawful authority. So they were basically fixing past mistakes. So it depends how you look at it. I mean, I personally was not in favour of the actions taken, but that was something that I had come to arrived at, having been looking at this from January, and I would agree that at the time, there was certainly, it was less unreasonable then than it is now, and now the continual reliance on this legislation, I don't believe is justified at all.
So because back then, again, referencing the fact that it was it was a justified movement rather than actually a legal to do that. How is that legislation being used now? How are the Bill of Rights being used now? Do you think have they changed the Bill of Rights so that they can now override us?
No, it's not. It's just that that's the way our Bill of Rights is written. So there is in Section 5 an ability for it to be deemed that it's a justifiable limitation on those rights. So that's there have been some suggestion that they are going to amend that in some way, but no, at the moment, that's just how our legislation works. But what we would argue, and if we had the resources right now to do it, and there are people, I know I was just called today by a group of people that are interested in taking legal action to pursue looking at the taking action against the government for unreasonableness of this lockdowns, is that but see, like, I'm getting a bit tired. I just actually lost my train of thought. But what I think what I was going to say to you is that it's not from where we are now. It's different. I think that, so now people will look, and what they'll try and do, what we're going to say is that it's not proportional now, given what we know, because now we know that indeed it's not as deadly as was once thought. And we can manage it. Like back then, people were saying the hospital is going to be overridden and all that kind of thing. I don't think even back then there was actually evidence to show that. However, giving them the benefit of the doubt, that's one thing. And so, but now, right now, when we're still in a state of lockdown and still being limited on our rights, I think that there's a very good argument that's not justified. And so we could relook at that proportionality.
A lot of people might argue that, the reason why we don't have all of the sicknesses and we didn't have all of the deaths was not because it was not the virus that we thought it was going to be, but because it was so well managed from that original lockdown. What would you say to that?
Well, you just have to look at other places where they didn't lock down, or even other places where they did lock down, but a lot less than us. So, for example, Queensland is quite a good comparison. We were overall here in our houses without being able to get out, and they were at the hairdressers or the beach or whatnot. And the rates of cases and deaths you'll see are very similar. That was one example. You've got Sweden that didn't lock down. A lot of people get confused because you're looking at raw numbers of people that have cases, which obviously cases is very dependent on how many people are actually tested. And then you've got to look at the actual rates of death. These countries, like right now with Sweden, the numbers are actually not showing any higher than their average mortality rates for the year. Like it's not even going to show up as an actual significant increase. So they did have an issue over there with their old people's homes, similar to in the UK, which has been a real tragedy in how that has been handled with people being sent home from hospitals. So that's a management thing. And later I was going to let you talk about what an alternative solution is, which would definitely include more efforts at protecting the vulnerable population.
Yeah. And do you think people are a little bit confused because, we can argue this till the cows come home and there will still be a lot of people, and in 30 plus, we have these conversations, and there are a lot of people who say, well, look, it's because we did such a good job here in New Zealand of locking New Zealand down, that's why we're doing so well. And then they'll make comparisons to the UK and, obviously United States. And when they're making comparisons outside of New Zealand like that, are they even relative to us in our situation? Or I'm not like an epidemiologist, so I'm not like an expert on this, but from what I understand, there's so many different things that come into play. With New Zealand, the reality is a lot of it probably would have had to do with the population, the way we spread out, the fact that we'd just come out of summer and we had really high levels of vitamin D in comparison to these other countries. We're an island nation. There was a lot of things going that made us different from Europe, from Italy. I mean, so many things people don't look at. Like I looked up how many people in Italy were aged over 90. Was it over 90 or might have been over 100? I mean, I think over 90, there's like 1 million people or something. Like it's just mind boggling. And so these are the raw numbers, but oftentimes people are reporting back raw numbers and they're not looking, at the age, what the average age of the society is, or obviously this is something that affected more of those 70 plus. And if you have a population with more of those in your more of those ages in your population, it's going to have a difference. But also the season, I think a lot of that we were protected with the fact that we would have had higher rates of levels of vitamin D. That was very important. So actually, Dr. Thornley also mentioned that he said, in his closing statement, it was about how would you have, like if we were to manage it a different way, what would you say would be the best way to protect ourselves now? And he did say that. He said, get out there, get outside, get your vitamin D, eat healthy, less sugar, less processed food, and just generally just living a healthy lifestyle. So that's, doesn't really sound like the kind of advice you would give to somebody fighting a pandemic. Is it still, do you know if it's still a pandemic or has it been downscaled?
I haven't actually kept up because the WHO seems to, the World Health Organization seems to be constantly changing. They declared it as a pandemic. I'm not really sure if I haven't actually taken note if they've changed that. I mean, obviously here we've had very, very small numbers of deaths. And even of those deaths, I know you would have seen that some of them that were actually classified as having died being COVID deaths were not, they were actually tested negative. So it's quite odd the way they can do that. Obviously, you've got the fact that some of them are with COVID, so it's a comorbidity. They've got other complicating factors, but a couple of them didn't even, like, they were testing negative. So there's a lot to unpack in it all. I guess the main thing would be that there are alternatives to how this can play out. And one thing, I mean, I just think a lot of the things that are happening, you need to like have a really critical mind and think, what is this? Why are we doing this? And let's just think, what are the logistics? So one thing that's quite funny to have a look at is the legislation around face coverings. So maybe we could talk about that, and then I could like to discuss the way that we, you know, personally, that I think is a good way to handle it. And that is something that the party that I'm representing, Advance NZ, is advocating as well, in relation to an alternative plan, since Labour and National are, and therefore the Greens and ACT, all following a similar pathway of just ongoing rolling lockdowns and you know, constantly like wearing masks and things like that. So we're looking at alternatives, but I could talk about that now, or I could talk about the face coverings. Because I know people have like kind of questions about that, and
let's talk about the face coverings, but just quickly before we go on, just a disclaimer to everybody listening. I didn't actually know that Claire was a candidate for Advance New Zealand when I approached her, so this is not a political stance that I'm taking one way or the other. I've actually requested via email conversations with lots of different people in different areas and arenas, so Claire just happens to be Advance New Zealand, but we're coming from the point of Claire being a lawyer who is very well versed in legislation, so that's our conversation tonight. So yeah, so talk to us about face coverings and everything that you know. Let us have it.
Yeah, well, I just think it was funny because right at the beginning when this legislation came out, the face coverings one, I'll just say what date it was. That was just, let's say here actually, it was just last month, I think, wasn't it? The 6th of September, they came out with this. So immediately everybody, you know, it's announced that masks is what a lot of people are saying, you know, masks are compulsory, and you drive up and down the motorways and I just see this big, you know, mask compulsory. And I guess they don't have much room for anything else on the sign, right? But most people therefore are like, okay, I have to wear a mask if I'm traveling on public transport. So I actually just decided to have a look at the legislation, and it's perhaps interesting to some people. Like, some people might not want to wear a mask, but they think that they have to. I mean, some people may wish to wear a mask. Obviously, I have no problem if somebody chooses to wear a mask, right? I'm just wanting to advocate for the fact that we should be free to do what we want to do. So this is especially interesting for people who, you might not realize that there are many different ways that they can legally not wear a mask on public transport. And starting with like the fact that, you know, the definition of a face covering is any type of covering that covers the nose and the mouth. So, you know, I've seen people, you can literally just have a funny little thing that just covers your nose and mouth. And just, so if you just, you know, I just encourage people to think, like, are we actually trying to do something that is for our health? You know, is that the purpose of this legislation? So there's a video that I put up, and I can share it with you, but it's the nano girl just showing how you can, you know, different kinds of face coverings that you can use. And she's just showing, you know, a handkerchief and rolling it up and sort of pushes it onto her face and says, you know, it's very effective and comfortable, when it looks entirely ineffective and quite uncomfortable. And, you know, it's a funny video, but I think, you know, you can just see by the expression on her face, she's not believing this, but this is what we are being told is an effective thing, and that we're doing it for either our or other people's health and well-being. So these are some different ways, that you don't actually have to wear a cover. They're all in the legislation, it lists it out, but the way it lists it out is a bit legalese, so maybe not everybody gets it. You don't have to wear a mask if you're in a vehicle that's 12 or fewer people, where the driver, one of the passengers owns the vehicle. So basically, if it's your own people mover, like you don't have to. If you're in a shuttle bus, like you'd go to the airport, you wouldn't need to wear a mask, which is just kind of a random thing, right? But if you are, if you're a child under 12 years, if you have a condition or disability that makes wearing the face covering unsuitable. So, that's huge. I mean, if you have any condition that makes wearing a face mask unsuitable, any physical or mental health illness, but also just any condition. So
how do they prove that if they're going to get on a bus and they're like, I'm exempt because I've got this condition? How do they prove that if it's not a medical condition?
Yeah, you don't have to prove it, and they've confirmed that. You do not have to you don't have to get any certificate from a doctor. You do not have to do anything. You can just say, I have a condition that makes it unsuitable to wear a mask. And if they ask you why, you can say, I'd rather that would be a private issue for me. So that is the law. I'm not saying that you might not feel nervous or that it might not be, and you might want to wear a mask, that's fine, but just actually legally. And the reason I believe that they've done this, there's actually a few more. If you're in an emergency, you don't have to wear a mask. If wearing a mask is not safe, if you're the driver in a defined space separate from the passengers, you don't have to wear a mask. Now, just understand that would be, in my opinion, pretty much every kind of public transport where the driver is sitting separately to the rest of the passengers. So the drivers do not have to wear masks. If you're communicating with a person who's deaf or hard of hearing, if you're asked to remove the face covering to ascertain your identity. So if you both don't want to have a mask on, you can just ask each other, I don't really know who you are, and then you can take your masks off, also when you're catching a ferry between the North and South Islands, but not if you're trying to get a Fuller's ferry to Waiheke. It's just these things that maybe encourage you to think, well, is this really making sense? However, if you just do want to know why you might not want to wear a mask, those are some. And, I just said, there's obviously a lot of people would experience anxiety, for example, or shortness of breath. Anything like that is a justifiable reason. And like I say, I think the reason they've done that is I could imagine in the future there'll be cases brought by OSH in relation to health and safety against workplaces. And they're kind of setting the scene for the fact that they want to be able to be, if someone's going to sue them for the fact that the employees have suffered some kind of injury from wearing the mask, that they'll say, well, you didn't have to wear it. I think that's where this is going, because there's so many exemptions, but you see and you look around and most people on public transport are wearing a mask.
So I've got 2 points about that. I've got one that, going to get your nails done, like that's the first time I actually experienced having to wear a mask, and then, had to do the scanning or whatever, which I didn't have on my phone. So then I had to write something out, and they gave you a mask, and they all wear masks anyway in the nail bars. And I thought that was interesting because they were full on. Everybody had a mask on and they were just handing them out to everyone. And then next door, like sort of the liquor store and the cafe beside, there were no masks. So, to me, it's like, oh, okay, well, that's not very, it's kind of not, it's like, isn't it if either everybody or nobody, or I don't know, kind of doesn't really make sense to me.
It's really tricky now for people in like cafes, because I've asked so many of the cafe owners, are you wearing a mask because you actually think it's effective? And they say no, but if I don't wear it, some of the customers might not come in, so I feel like we have to, because the cafe down the road is. So it's this kind of ties into when you met me, or I don't know, you saw when I did the speech. What I was saying to people is just I think it's good to just stop and think. And like I say, I have no problem if somebody wants to wear a mask because they think it's going to help them. I mean, I have myself researched plenty of information which strongly would suggest that it's not helping. However, if you feel like it is, or you're genuinely fearful, or for any reason, of course you can. But I'm really speaking to the people who either don't think it works, but they think they have to, or don't think it works, but they just don't want to rock the boat.
Yeah.
And it's just so important, I think, to rock the boat. It's important if you believe that there's a problem with and an inconsistency and something that would suggest that this is not all about health and safety, that it would be something that you would take a stand on and speak out about. Because when you do that, it actually helps give a voice to other people who can also start to question and just apply critical thinking to the whole situation.
But it's really scary, wouldn't you say? Because, you know, like, I don't want to use the word indoctrinated, but when everybody's being told to do a thing and, you know, and there's fear involved in that, which I feel like, I guess there is, how, you know, if somebody doesn't want to wear the mask and then they don't, and then they're going to get bollocked for it, or, you know, yeah, just basically they're going to get bollocked. So it's such a huge ask, isn't it, to be brave and be a critical thinker and be doing things that are a little bit outside the box. You've got to be quite brave, don't you?
I guess I mean, I don't find it so hard, but it is a personality thing. Like, and I guess I feel easier to do it because I've spent so much time researching it. So I feel very confident in my stance and in backing that up. And if somebody actually asked me, I could send them links and tell them, you know, this is this doctor and this scientist and this epidemiologist. And it's funny because it's become such a, Simon Thornley, he actually said on television, the most surprising thing about the debate about COVID is the lack of debate. Like there isn't a lot of debate. What you mostly see is it's reported in a manner where they really shut down what you're saying and dismiss it as a conspiracy, or people, a lot of times they say people questioning anything about COVID has been that you're saying it's a hoax. I do see how it gets confusing. I don't use that term that it's a hoax, but some people who do, they're using it to talk about, they're not talking about the virus itself, they're talking about the way in which we have responded to it and how it's either simply, you know, an ineffective way of managing it. So it's not, it gets all wrapped up. You know, obviously there's a whole spectrum of views in relation to this, but I think it should be fair enough that we should be able to have a debate. And a lot of times what happens with the doctors and scientists and the epidemiologists who question it, they're just immediately called, smeared, or people go and write up Wikipedia links about them and lock them. And I mean, I don't know, I just had this experience with my brother because I'll be telling him really amazing doctors, and within a short period of time, if they've never talked out about something that's contentious, then they talk out about it. It's literally, and it sounds silly, but a lot of people do look at Wikipedia a lot. So they'll publish the stuff and then lock it. And then next minute, your person is just some sort of discredited weirdo. And you're like, no, they're actually, you know, a legitimate person. There's huge, big names who are calling into question the whole management of what's come to pass, right? So, but it's really often made to sound as though they're some marginalized small number of people. But you've seen, like, I think just recently in Belgium, there was 500 doctors signed a letter. There's been a whole lot of doctors in Australia signed letters together against the lockdown. There was a big group of American doctors got together, and then their website got taken down. Like there's a lot of discussion being crushed and not allowed to be freely debated about these issues.
Why is it being crushed? Why is it not allowed to be debated? And is that legal, that they can just shut people down like that?
Well, you see that the trouble, we've become so reliant on social media. So that's where a lot of the discussion takes place. And then those are private platforms, although some people argue they carry out a quasi-public role, so that there could be, I know there are people trying to bring that further in. Otherwise, I guess it's not good. Like, I would say journalism has really suffered, and then you have situations where I guess our government recently had to bail out a lot of the major avenues of journalism so there could be argued to be compromise there. But even before all that started, we all know that well, I guess we know that a lot of journalism these days, you can pretty much get anything published that you want if you write it and send it in. Or I know the Plan B guys who Simon is with, they had an article published, it was back in April or May, and it went up and it was quite good. It actually put a good point forward about different ways of thinking. And then later that day, the whole article was changed. Everything was changed about it. Like, we took screenshots and someone had obviously, an editor, come along and said, whoa, we can't have that. And that is wrong. Yeah.
That's actually terrifying, in fact, because is it 1st of October when there's going to be some changes in what you're allowed to say freely online? Is that just New Zealand? Is that social media, or do you know much about that?
That I understood was a Facebook. I think I was sure that's a Facebook thing, but just Facebook. Does Facebook own? They're on YouTube as well. It's all Instagram. So Instagram maybe. So yes, they've said that they're going to be changing their policies, and basically the way I understand their policies are going to change is that it's just going to mean that they have yet more free rein to quash, speech or information that they disagree with. But it's quite, yes, we don't really know what's going to happen, but obviously it's likely to be something not good at all, because already half the things that I would try to share come up often with a covering over, like a warning, like this is false information, or so forth. So, and even when you type in Messenger, it won't let you send something. Like, they are monitoring all the Messenger chats as well.
Amazing, eh? And actually, I did an interview on, now who was it? I think it was Simon's interview. And somebody went to share that, and that had a covering over it as well, saying that it wasn't, that it was not verified information or something like that. I was like, what? That's the interview or the chat that I did. So what the heck? All I was doing was asking questions and he was answering them, and that got a covering over it as well. So yeah, so it's quite scary. Oh man, okay, the whole thing's quite scary. So, and that's why I want, to have experts in, just so we can chat to them about what they know, so we can kind of dig to the bottom of it, because I don't watch the news. I haven't had a TV to watch for like 7 years now. So what I see is, first of all, in the first lockdown, I saw a lot of stuff on social media, like all of us did. And then I saw a lot of it get fact checked, and then people were getting shut down left, right and centre. And that was the thing, I think, that triggered me to say, what's going on here? There's something freaky going on here. Our freedom of speech, where is it going? And things that were legitimate 1 minute were then fact checked the next minute. So just like you were saying. So I thought that's when I started digging deeper for some more answers and getting some actual experts in to talk about it. So what have we were going to talk about? Okay, I don't know whether this is something you want to talk about now, but the fact of the mask wearing, and you said it could be leading into other things to protect businesses or to protect people from something. What about this whole vaccination thing? Is that another whole different subject, or?
Well, I mean, you can't, it's not like a conspiracy theory to say that the government has as an intention to have, if not everybody vaccinated, to achieve a level of vaccination which they have yet to decide, what that is, because they're saying, based on herd immunity, and it's not clear what that is. But for example, they are not yet satisfied with the level of vaccination that relates to measles, where you have over 95%, I believe it's 95% of the country, in some places up to 99%, and say for South Auckland, very, very high numbers, and they're still saying, doing big drives to get more kids vaccinated, increase the level of children. So I think, you cannot say that there's not I say agenda. Agenda seems to have like a word, like it is kind of conspiracy, but there is a plan to have as many people as possible vaccinated to achieve herd immunity. It's just something that is quite, I find it's just hard to wrap your head around it when you have a look at the number of people like that globally, because we haven't had the numbers here. So if you look overseas to see the numbers, like 99.9% or something like that of people are fully recovered with no problems going forward, especially people who are in the under 50-year age group, right? Yeah. And so the vaccination itself, in this particular case, is experimental, new type of vaccine. These RNA vaccines, like I haven't brushed up tonight on all the different kinds about the vaccine, and I'm not an expert, but there's a lot of red flags. Like a lot of people who would normally be happy to be vaccinated, or doctors who are pro-vaccination are hesitant or outright say they would not take this particular one in the form that it's being proposed and with the level of safety checks and so forth.
So because we're talking about legislation tonight, how is it that they'll be able to roll it out in a way that we have to, like it's a mandatory vaccination? I know they've said that it's not going to be mandatory, but it sounds like they may be.
I don't believe they would ever. I think they won't say this is mandatory. I think what would happen is they would make it, as they have in America and in Australia, what is termed this no jab, no pay, no jab, no play, particularly being evident in Australia with the childcare. So you can't, if you're a working mum and dad and you can't take drop your kids at most daycares unless they're vaccinated, you're going to effectively end up vaccinating your children as a matter of practicality, unless you have very strong views on it. So that's how it would happen. It's more of discrimination if you don't, like if you want to travel or if you want to go to a certain place or certain jobs and that kind of thing, and it brings it in. But I just think it's obviously a huge topic and people have huge, very, very strong views. I vaccinated my son because I didn't know, it's crazy, right? Like I researched so much and such in depth into such ridiculous things. Now I'm thinking about it, like the cot, and he's an only child. I was like over the top, got all the best pure organic everything, and yet when it came to vaccines, I didn't even think. And I always even did more than what, because I was of the mindset, well, if you have to pay for it, it must be even better. So I actually even got an extra one, I think, for the rotavirus before it was actually on the schedule. Yeah. And it was just incredible. Like, even I would encourage people now, it's not about whether you're pro or anti, just research things though, right? Like put as much effort as you would into choosing what stroller you get as to looking up and researching. And most people don't have to actually, if you're honest with yourself and look at the information, like calmly, not just quick look on Google and like ask someone, hey, who might have looked at it, hey, what information can you show me? And just sit down quietly, cup of tea, read some of this information. And most people that do that will end up having some quite serious questions about how this has been handled and how it's done, and they might want to reduce them or modify. There's different things that might happen. For me, I'm a researcher. Like that's how I got into the food with the paleo. I started reading and I realized, oh my goodness, it's not about low fat. I couldn't believe I've been eating all these egg white omelets. Like it just was this whole epiphany to me about food and how you needed to eat for the nutrients and eat real food. Like, cause I was one of those real, label reader and like trying to get the low fat stuff. And then I was just like, what am I doing? Like I should just eat real food, not the diet, everything. Jenny Craig, I remember I used to have that. So it's a little bit like that I feel like with the vaccines, when you sort of look into it, you'll start thinking, look at the death rate, look at when it changed. Did it change because vaccines being introduced, or did it change because of sanitation and running water and that? Just have a look at these things, and then also have a look at what are the likelihood of my child having that in New Zealand. Like maybe you'll have different decisions if you're about to move to Africa. You might. Some people wouldn't, but I just think really critically and look at what am I protecting against, and how are people maybe protecting against that using more natural ways of doing that. Like what are they taking? What are their children using? For me, the decision for me when I looked into it was that we wouldn't be having any more in the future. And I did take on the responsibility. That means, better gut health, being very conscious of your natural immune system and how you can best support that.
Yeah. So with vaccinations and with mask wearing, it sort of comes back to the same conversation. That's do we have rights, or will we just be kind of ostracized into doing what we're being kind of, the narrative that's being driven is a fear-based one. So are we going to just be, in a way, the word feels like herded into wearing masks, herded into taking vaccinations? And do we have any loopholes? Is there any way that we can say, well, I really, 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 really can't or don't want to get a vaccination, but I do want to still contribute and play and be in life?
Well, I mean, the actual part, just in case people are interested, like it's the COVID 19 Public Health Response Act. It's Section 11, which people argue about whether this covers it, but it's incredibly broad. Under that act, orders can be made to require persons to take any specified actions or comply with any specified measures that contribute or are likely contribute to the preventing of the risk of an outbreak or spread of COVID-19. I mean, so then there's a list of things that are included, but it says including but not limited to. So then there's some specific items listed, but what I just read out there essentially means that any action, like anything that they think would contribute, so it doesn't even have to prevent it, right? Just contribute to preventing the outbreak or spread, right? So very low threshold to fall within that. And that could be a vehicle by which they bring that in. That already definitely is covering like the testing that they're using that for.
So was that the legislation that was reworded during the last few months?
They did reword it, but they didn't reword that part. That stayed the same, the header part. So you could fall within that, and then what could you do? Well, I think there will be legal challenges. Like I said, I did get contacted today. There's a group of people interested in pursuing that, and they've done that in Australia and successfully in Canada. They've challenged some of this legislation. So what you would do that, there'll be different ways, but one way is to be saying that, well, clearly at this point in time, the threat is not such that it's in proportion to have a limitation against one of those fundamental human rights, which includes the right to, refuse to undergo medical treatment. And these are freedoms that were enshrined from things that have happened in past, and for war crimes and things that went on or alleged to go on in different wars. So that was where this basis of being able to refuse medical treatment.
Yeah. So okay. So I think we've covered quite a bit tonight, but I thought in finishing up, what would you say is what would you say is your battle cry? What are you trying to stand for? What is it that you are strongly committed to at the moment with regard to this whole entire, I guess, COVID, vaccinations, all the legislation around it?
Well, I think I've said quite a few points during tonight, is just to critical thinking, just to not accept necessarily what you're reading in the papers, to dig a bit deeper. And when you find things that, seek out people that might be saying a view contrary to your own. I mean, we all know we're scrolling through Facebook and you get that person and you're just like, I want to delete, I don't want to have that. But it's actually quite healthy if you can take a deep breath and think, is there something there? Do I want to just have a little peek down there and just see what's going on? So for me, it's about firstly looking harder, just considering matters further. But then secondly, if you do find something, being brave and speaking up. And for me, I know you get, I get criticism all the time. Well, you're not a doctor, you're not you're not an epidemiologist, you're not a scientist, you don't. Well, I'm like, yeah, but I'm a critical thinker. I've got a law degree, a patent attorney degree, a history degree, a French degree. I have studied for 13 years and I know how to read documentation. People say, you know, they're quite dismissive. Oh, it's Google, you know, everything's online now. That is how people get the information. It's not, even when you go to university, you use online, you can use huge repository of information online. So it's not, you can't just discredit something because it's online, you know, it's how you read it, how you critically analyze it. So that's what I would encourage people to do. And like when you do that, for example, what you know, one thing we could do, just as something different from what these rolling lockdowns and mask wearing and things, is to go for, you know, a risk-based approach where vulnerable citizens are looked after. Like, I think of all the resources that we've had spent with just the community and the money. I mean, it's going to come out, like, even there's a recent paper published from our own government which shows that I think it's a 96-to-1 negative, like, ratio of the it's based on QALYs. Like, it's hard to explain it, but basically it's like a huge failing doing the lockdowns. Like, there's so much more detriment being caused to our societies as a result of that. And I can get you that paper if you want, because it's actually pretty cool. Simon Thornley showed it to me, because it's, maybe there's like this whistleblower in the government that's produced this. It's a bit surprising. But the other thing is just to look at alternative treatments, you know, hydroxychloroquine, zinc, zithromycin, like these sort of things that you've heard about. Isn't it a bit strange that they were shut down from use? And, you know, a lot of that, I think it's a 70-year-old medicine that's been used safely for all around the world and been prescribed off-label, which basically means the doctors can prescribe it for something that it wasn't originally for. Say it was a malaria drug, but they can use it for other things. Now, there were some issues, you know, the Lancet, which is a big medical journal, published that and said that there was a problem. But then it turned out that they'd been using, I think it was like 4 or 5, like a huge, maybe more, like massively more dosage rate than you would. So of course it came out that it was unsafe. So I think, yeah, that's my big message really, is to just think critically and then be brave and speak up when you find something that doesn't sound right to you.
Yeah. Okay, well, that's amazing. And I guess we can take it from you, because you are a critical thinker and you're a lawyer with many years of study under your belt. And I think I'd prefer to take your advice than just somebody who's been scrolling through calling everybody else a conspiracy theorist, because that is actually one thing that kind of grinds my gears, is that, you know, it really is just anything that somebody doesn't agree with or hasn't looked into themselves. It means their ulterior philosophy or theory is a conspiracy theory, and you're a tinfoil hat wearer, or whatever they say. But I just think it's really, really smart to dig deeper, because like you said, you don't necessarily get all of your true information from journalism these days. And then there's so many people, like just even what we're doing right now, there are so many people who are actually having the deep conversations with other people who do know what they're talking about. So there's information everywhere if you dig for it, eh?
Yeah, I think it's good. I mean, I know myself, it's easy to get in a bubble, and it's good to be challenged, and because you do end up, you know, you talk to the same people. So it's probably, even though I don't like talking with my brother because we wind each other up, you know, he tests me out on what I'm saying and makes me, you know, challenges me. So that's a good thing. I think when you have somebody, you know, like I think our Prime Minister, she said, you know, we are the only source of truth. And that, I think, is a dangerous perspective, right? We don't, that's not how we want to run things in a democracy with freedom and transparency. We don't believe that our government is the single source of truth.
See, now, like, you know, regardless of what anybody's affiliation is, whether they love Labour or Nats or whatever ACT or whatever, whoever they love or prefer, that did just that one quote that she said, that we are the single source of truth, that freaked me out. Like, when I heard that, I was like, I heard you say that freaked me out. But I understand why she said it, because, you know, so many floating ideas everywhere. But I still thought, no, you are not. That is just so far from the truth, if anything. So yeah, that was a little bit, oh, but you know what, all of that aside, you know, you can be misquoted and things can be taken out of context and all that sort of thing, but all that aside, we should be looking for truth in all different places, and I think having these conversations is just so good. So thank you so much for coming along and sharing tonight, and I'll grab some links off you for those bits and pieces that you said.
Yeah, you can. If people want, I mean, you can look me up, Claire Deeks, online. I have a lot of I do a lot on Facebook, just generally, that is public. And I did just create a page, Claire Deeks, for advanced. I haven't, advanced NZ, I haven't put so much up there, but yeah, it's certainly not it wasn't on my bucket list of things to be doing. I got in touch with the party to do, social media and marketing, because I wanted to help them with the website and Instagram and things like that. And one thing led to another, and Billy, the leader of the party, asked me, would I stand as a candidate? So eventually here I am, but I'm actually just enjoying it. It's different, and get to use my legal brain, and just it's a challenge. So it's something quite different. Honestly, 2 months ago, if you would have asked me if I was doing this, I would have not said yes.
So you guys are amazing. Like, I feel tired just listening. Everything happens and with candidates. Okay, cool. So we'll look you up and we'll grab some more links off you.
Awesome.
And we'll pop this video up on YouTube as well for other people to have a listen to. But thank you so much for coming along. Appreciate it so much.
Thanks a lot, Natalia.
Hey, night. Cool. Okay, so that live stream is, whoops.